Good afternoon, guys. Thank you so much for coming and seeing our anatomy building. My name is Dr. Brady Little. I'm an anatomist here at Ross University and the division head for anatomy. I'm proud to say we're one of 5 veterinarians that would be a part of your education here. And so you'll be working with all of us. I want to introduce to you one of our exemplary students.
Hi, my name is Sine. I'm in my 2nd semester at Ross. I'm just helping out with the tour. I'm also a student ambassador at Ross, and I'm very passionate about small animal medicine.
Awesome. So as you can see behind us, we have our anatomy museum. This is called the museum because it houses all of our dry specimens, bones, plastinated, that's preserving with no liquids, as well as behaving kind of like a library. So resources that you might find in a given library, you can come here as well, although anything you need on paper would also be given digitally to you when you arrive via iPad. This is also a place where people come to study just to get away from anything else. It has a nice, beautiful view of the Caribbean Sea, air conditioned, and gosh, you might think of anatomy as being kind of maybe even a little smelly, dead things laying around, bones, but you'd be surprised. It smells quite nice in here. We've just introduced a very large, impressive air handling system with filtration, air conditioning, and then it evacuates air and recirculates. It does that about every 3 to 4 minutes. So we're talking about, 15 times, 20 times an hour. Long story short, it's a nice, clean, safe facility for you to study from 6 in the morning till 10 at night.
I also just wanted to add in that in our anatomy museum, we have a bunch of different specimens that are available. We have a lot of different bones that are available here. We don't have just 1 or 2. So you're able to look at many different types of specimens, plastinated, or if you want to look at these bones. So I just like to come here after class and just spend some time looking at the bones. There are plastinated specimens that are in here as well. They're also available for you to use.
All right, so we're going to take you from the museum now into our actual dissection halls. So we'll go by a couple of offices now, technician's office and our lab manager's office. We'll go by some storage areas, and now we're in our dissection hall. You can see it's a pretty large area. You'll spend a fair amount of time in this hall. I say a fair amount of time because you'll be in lab 2 to 3 times per week, each lab lasting 2 hours. During that time, you'll be in a group of 4 to 6 students, each sharing a variety of specimens, though largely focusing on the canine. The reason we do that is, as different as we all look, we all have very similar tissues. So my humerus doesn't look a great deal different from a dog humerus. From there, we extrapolate to large animals, equine, bovine, other small ruminants, and a little bit of introduction to avian. Then, of course, you'll have an opportunity to learn exotics and so forth in other courses. So you and your lab mates will have an assignment to one of the tables that are very similar to the one behind me. And in here would be specimens for your lab group as well as those from other semesters. I say other semesters because gross anatomy is really a 2-semester course that's just broken up. So GA1 and GA2, they're not a more challenging version in GA2 and a less challenging in GA1. It just takes 2 semesters to get through the entire course. So all of those specimens you'd be sharing amongst your table, of which there are about 22 of them in here. Every day when you come in, you'd reach down to this lever and we roll this up. As we roll this up, this bar goes down and a tabletop inside of this, which has low dose formalin, actually less than a percentage, raises up so that the bathing material for your specimen can drip off, and we lift open the specimen lid here. Now we can work on a nice flat clean table, and we do it in reverse. Really nice, because every time we do that, we keep our formalin fumes gone out of the air is being recirculated, nice clean fresh air. It also keeps any spills at bay, and it lets our specimens stay in the best possible condition. I also want to make you all feel very comfortable about the sourcing of our materials. So We never ever have to use animals that would be euthanized specifically for our purposes. What does that mean? That means that no animal died specifically for us. Animals that have been euthanized due to quality of life issues, issues where they'd be impossible to rehome or get adopted, were diseased or traumatized, or otherwise needed to be terminated, in which case then we can utilize those bodies rather than them going into a mass burial or just wasted away in an incinerary somewhere. So no guilty consciences about utilizing these tissues to learn from.
I also just wanted to add in that we also have TAs that are available for GA, and those TAs are available multiple times a week. So if ever you feel like you're behind in GA or you need more help, you have those TAs that are available to you, as well as the professors, which are also very helpful.
Really good point. Yeah, so every year, every semester that is, we have students who have excelled in this course and have then applied to be assistants for our students. And so of course, you as students are encouraged to email us, call us, knock on our office doors, and we'll help you out however we can. However, there's a lot of students, and maybe you want some help from someone who was just in the course last year. Certainly helpful to have that team of TAs. Quite a big, talented team of TA students. Now, obviously, anatomy is a quite complex subject, and we're all working in a big dissection hall. There'll always be 3 or 4 faculty members in here to help you out, but sometimes all of the students have similar questions. So in that instance, what do we do where we can all work together as a big group? We link up our iPad, and we get a handy-dandy camera woman, and she can film what I'm doing or another faculty is doing to direct traffic, so to speak, and we can discuss very particular items like this is the deltoid tuberosity, and this is the acromion, and we can dissect out specific areas, and we can discuss as a team what's going on action, what's going on neurologic function, what's going on if we were to have disease in that area, how would the animal then manifest its symptoms? And in doing so, students can follow along a dissection via multiple screens throughout the dissection hall, and hopefully we're helping many students all see the same thing all at once, never have to crowd around the same specimen. Works out really well.
So the way that you're tested in GA is a little different than how you would have been tested in university. So we have a bell ringer style question. So basically you're going to have a total of 1:30 for each of the questions. You're going to come up to a station. So for example, we just set up this one for you guys. So station number 8, you're going to look at what is tagged here. Here we tag the patella. Look at what's tagged, answer the question, and then move on. So the room will be arranged with 45 questions in total. You get to walk around the room and answer all of the questions. It is definitely a little stressful, but I think it's a very good opportunity for you to think on the spot, because as a veterinarian, you will have to be put in those type of situations where you do need to think on the spot. But one really nice thing about GA1 is that you get the option of participating in a mock exam. So basically the room will be arranged up just how it would be for the actual practical. But in that situation, it doesn't count towards your mark. You will just have the opportunity to see how it is to actually do a practical.
TAs are really good about creating these as well.
Yeah.
So there's practical exams in practice format with the teacher's assistants, and there's even those created that are in digital format, so you don't have to be here in the lab to practice. Really good to apply the concepts of not only what is this tissue, but what Mother Nature created it for, how it's going to cause action, and what even might your patient manifest if that piece of tissue were to be diseased. So all the expectations of a veterinarian. So on day 1 of your first anatomy lab, you, along with the students that are assigned to your group table, will be assigned what we call the bone box. And this is the bones that are associated with the study of the materials for that given semester. The reason this is handy is, given any period of time from 6 a.m. to 10 p.m., 7 days a week, you can come in, grab your bone box or any other of the dry specimens or even the wet specimens that you've been dissecting and study after hours. So you could go and grab your bone box. We have little lockers for them. Grab the bone box and you can study with your teammates all the different bones that we're associating movements, muscles, ligaments, and tendons. really helpful. I know in lab there's certainly a lot going on, and maybe you want to rehash some information in the after hours. Good to come in and go over that material again, just to test yourself and each other to prove that you're ready for the assessment. Another resource you can use after hours.